We brush our teeth twice a day and we floss. We go to the dentist every 6 months and we get x-rays and an oral exam done. Our pets aren't doing that. They might have that done once in their lives. So if we can get the pet owner to realize that if we only had one procedure done in our lifetime, we would definitely have some dental disease in our mouths.
Hey, VetFolio Voice listeners, welcome back. Let's talk dentistry. Dentistry is one of my favorite parts of veterinary medicine. There's something so satisfying about taking a painful, diseased mouth and just completely transforming a patient's quality of life. It never gets old seeing these pets come back on recheck and they're bouncing around and they're feeling so much better. But as much as I love a good before and after moment, as someone who works on teeth a lot, I am deeply aware of all that goes into making these procedures safe and effective. In this episode, I sat down with Denise Rawlings, who is a VTS in veterinary dentistry, and we walked through what goes into a dental procedure. From the initial consult to admission to the hospital, anesthesia monitoring, recovery, and of course, the all-important recheck at the end. Whether you're looking to maybe refine your anesthesia protocols or improve client compliance or just make your dentistry days run a little bit smoother, Denise had some fantastic insights. Let me tell you a little bit about her and we'll get into our episode. As I said before, Denise is a veterinary technician specialist who's dedicated to improving the oral health of animals. She graduated with honors from Madison Area Technical College in 2001 with her Associate of Applied Science degree in veterinary technology. After trying out various fields in veterinary medicine, she found her true calling in dentistry and pursued her VTS in dentistry through the Academy of Veterinary Dental Technicians in 2014. Denise founded Pet Dental Education, LLC in 2017 to promote education and innovation in veterinary dentistry. She provides on-site training to veterinary hospitals all over the country, aiming to improve the standards of dental care for animals. Additionally, she's served as a dental educator for several companies, teaching and inspiring others with her expertise. Denise has taught and assisted in over 200 lectures and wet labs over the years. And apart from her educational efforts, Denise has also provided compassionate dental care at the Pet Dental Center in Estero, Florida, enriching the lives of pets one tooth at a time. Denise's commitment to excellence in dentistry was recognized in 2020 when she received the Rising in Dentistry Leadership Award from the AVDT. She also served as the Director-at-Large board member of the Academy, furthering her impact on the profession. Additionally, Denise is the honored recipient of the Viticus Group 2024 Veterinary Technician Speaker of the Year Award. Denise has recently changed roles and is now the Practice Development and Improvement Specialist for IM3 Incorporated, where she can pursue her flair for dentistry by helping practices increase their standard of care in veterinary dentistry. Let's go ahead and talk teeth.
Pet parents are looking for a veterinary practitioner who can prove they understand and support the relationship they have with their pet, show you value your client's trust, and earn an official Human-Animal Bond certification from NAVC and HABRI, the Human-Animal Bond Research Institute. This certification, appropriate for all members of the healthcare team, explores the scientific benefits for veterinary staff, owners, and animals, and discusses how to establish and promote a strong human-animal bond. Enroll today at vetfolio.com.
I'm here with Denise Rawlings, who has generously agreed to join me this afternoon, despite the fact that she's been walking miles and miles around VMX, teaching dental labs, and has probably been talking about dentistry all day long. You have agreed to come and sit with me and talk about dentistry some more, so thank you so much.
I'm happy to be here. I will talk dentistry all day, every day.
You and me both.
Yep. Labs, lectures, just random people on the street. I can talk dentistry.
I'm glad I'm not the only one. I'm like, you want to know something? No, you don't want to know, but I'm going to tell you anyway.
Right,
yep.
right. Can I see your dog's teeth when you walk by? And then
like
you
the
have to have that whole
automatic
conversation. Yep, automatic.
Petting them, and then you just kind of lift the lip.
Yep.
Mm-hmm. So glad I'm not the only one. Okay, so talking about dental consultations, because we know dentistry is so important in all animals. I'm thinking specifically companion animals, because that's the type of medicine that I do. But it can be hard to really drive home how beneficial dentistry is in our patients beyond bad breath. Like I'm thinking like when we're talking to pet owners and things like that. So I would love to talk to you kind of starting with the dental consultation and how we have an effective dental consultation with pet owners.
Yep, that's a good point to start with. Dentistry is so important with our dogs and cats. Over 80 to 90% of our dogs and cats over the age of 2 have some type of dental disease. So basically, if a dog or cat comes into your practice that's over the age of 2 or 3, we can expect that they have some type of dental disease. And not a lot of patients come to the veterinarian saying, or the owners aren't saying, something is wrong with my pet's mouth. So it's our job to find it on an oral exam. So we start with an awake oral exam. Super important to check the occlusion, how the teeth touch, especially with puppies and kittens. If they have an occlusion that's causing trauma, that should be corrected sooner than later so they don't have a lifetime of oral pain and then it's not found when they're older. And then something like periodontal disease, pet parents usually notice bad breath first. Or they might think that it's normal dog breath or cat breath. But really, if they're smelling that, that is that bad bacteria in the mouth that's been multiplying, causing that periodontal disease. So just like a person who has good oral hygiene, a dog or a cat would not have bad breath if they didn't have some type of bad bacteria in their mouths. So starting with the halitosis is great. And then being able to recognize dental deposits, plaque and calculus on the teeth, looking for any type of lacerations, foreign bodies, oral masses, having those conversations with the pet owners and communicating to them, dogs and cats get the same disease that we do, periodontal disease. It's caused from plaque bacteria. So if we can coordinate our dentistry to our pet's dentistry. So we brush our teeth twice a day and we floss. We go to the dentist every 6 months and we get x-rays and an oral exam done. Our pets aren't doing that. They might have that done once in their lives. So they are going to get the same disease that we are. So if we can get the pet owner to realize that if we only had one procedure done in our lifetime, we would definitely have some dental disease in our mouths.
Gosh, that's a really powerful way to put it because I'm someone who deals with the fun dental genetics and spends good quality time at my dentist's office. And sometimes I wish I didn't. And dental pain is terrible. And the amount of help that I feel like I've been able to receive when it comes to dental health and the better quality of life that has given me in terms of like discomfort and things like that. When you really think about it, like, okay, now you only get that once in your life. I'm like, oh my gosh,
right.
I would be so painful.
Yes, I can tell when I am due for my next 6-month checkup. And I couldn't imagine not going to the dentist.
And then we get to talk to the dentist about and compare notes. And
right,
that
totally.
part's really fun too. So of course, among other hesitations that sometimes we encounter with pet owners, anesthesia certainly makes the list. So I'm wondering how you talk through anesthesia in those consultations with pet owners.
I agree with you. I think anesthesia is, I would say, probably brought up more often than the cost is, because I know cost is a concern, but in my experience, I have found people are most concerned with anesthesia first. And let's make sure it's something that is going to be safe, and then we can discuss other stuff. But doing a complete workup for that particular patient can really help put that pet parent's mind at ease. And not only that, it's practicing good medicine. It's what we should be doing because we want to be practicing the safest medicine for our patients. So there's things like regular blood screening, so a chemistry and CBC, pretty standard baseline. Everybody should be getting that. And then as our patients get older, so to be honest, a lot of our dental patients are geriatric because they aren't getting the dental care when they're younger. So we're seeing them when they're older, perhaps for the first time for a procedure. So recommending thoracic radiographs is a good idea for any geriatric patient. I know some practices do it as part of their geriatric screening annually. And for patients that heart murmur has been heard, we recommend thoracic radiographs. And a step further than that, we even recommend a cardiologist for an echocardiogram, perhaps. Or if there's abnormalities with that thoracic radiograph, then we would recommend to see a cardiologist. If you have a patient that is going to have major oral surgery, like we're talking about major mass removals, something, or a breed that may be predisposed to have a clotting issue like greyhounds or Dobermans, a clotting panel is not a bad idea. Urinalysis, I know a lot of people do with annual blood work, so that, of course, is always a good idea. And then pre-op ECGs, blood pressures for geriatric patients, for sure. It's great to get all of that information. Once we have that, then we can have that honest conversation with a pet parent like, all right, we have early stage renal disease. This is what we can do about it before or after the procedure. Very rarely do we have to cancel a dental procedure or not do a dental procedure due to the pet's health. If we know about it, it can be planned for ahead of time. So those higher anesthetic risk cases can be set up on a day where perhaps a more experienced team is on, or an anesthesiologist can be consulted with ahead of time to make sure that the anesthesia is going to be the safest for that pet.
Sure. And I think talking about the steps that we take ahead of time is important because, like you said, I would say my experience is the same. It's very seldom that I would say I'm not going to do this procedure because of the anesthetic risk. Those animals are in pain. They've got a lot of bacteria in that mouth that is causing problems, of course, in the mouth, but also elsewhere in the body. They tend to need these procedures. And I agree with you that it would be very uncommon to not go forward because of a health concern. Yet, I do certainly sleep a lot better at night, the night before and the night after,
For sure.
if I have more information and, I can offer, maybe it's more reassurances, maybe it's just more information to the pet owner.
Absolutely. And it's never wrong to refer a case either to a specialist, either in dentistry or anesthesia or whatever might be out of your comfort zone for that particular pet. It's never wrong. I mean, we all want the best thing for our patients. That's the goal. We don't want to anesthetize a pet that it wouldn't be safe to. So we're on the same side with the pet parents. We want the same outcome.
Absolutely. Absolutely. And you can, like you said, we can always offer. And that resource is always there. So I would love to talk about your kind of protocol, you're going through the day when these patients come in and they're undergoing anesthesia and having this dental procedure. Let's start with the time these patients walk in the door in the morning, which they usually know something's up because they haven't had breakfast and they're usually not thrilled about that, to induction.
Yes, you are absolutely right. They know something's up. And they're like, I was just here a couple of weeks ago. What's going on? It's usually a longer interval while I'm back here. So generally, we start with reviewing the treatment plan, which includes an estimate, again, with the pet parent of what we think may be happening that day. Review that, make sure everybody's on the same page. I always try to get emergency contact numbers. I know we do for anesthetic procedures. Same thing with dentistry. We want to be able to get a hold of them if the plan is changing. We find more teeth that need to be extracted, or maybe an oral mass, and now we are going to recommend a biopsy. We want to be able to contact them. So we confirm all of that. Everybody gives kisses, and then the pet parents sadly leave. Then we'll take them into the treatment area. So we usually recommend that they have some anti-anxiety medication the night before and or the morning of, depending upon that pet. So we'll usually recommend something like gabapentin and or trazodone, just to help them be a little bit more calm coming in, because we don't want a pet sitting there all day really anxious and nervous and scared. That's not good for anybody. It's not good for them. It's not good for us. So we have found that it really helps them be a lot calmer. We're able to get an IV catheter in, get their TPR done in the morning. So we'll have the doctor involved and the technician that's going to be monitoring the anesthesia, get the TPR, listen to the patient's heart and lungs. And depending upon where they are in the day, which we usually decide a little bit earlier, but we'll get their IV catheters in, find out if the doctor wants them on IV fluids. If so, what rate, for how many hours before their procedure. And then when they are up, we'll go into the induction room to start the induction.
So if I'm hearing you correctly, it sounds like there's a lot of review prior to this patient even entering the treatment room. And of course, they're in the treatment room, they're getting their IV catheter, and they're doing all of this. But it sounds like there's a lot of discussion that goes on, in particular with the pet owner, prior to the animal even making it to the treatment area. And I'm assuming probably reviewing that treatment plan is probably a good refresher for the team as well.
Yes, when we go over the treatment plan with the pet parent, we also will discuss confirm that there was a heart murmur, went to go see the cardiologist, cleared for anesthesia. The cardiologist recommended X, Y, and Z. So we'll review that. And either before all of our patients come in the morning or after they're all there as a team, whoever's involved in dentistry that day will do the morning rounds. So we'll review the cases that we have for dentistry for that day. So we'll go over the signalment, pre-existing disease, coexisting disease, what workups were done, confirmed that the veterinarian on that case saw the results of that blood work, looked at those thoracic radiographs. And then we'll pick the order for the day. And we have found what works best for that is we tend to like to do the higher risk cases first. One, those pets need a little bit longer to recover, or we may want them in the hospital longer, even if they're doing great, just for us to monitor them. So we'll select the order based on their anesthetic risk, how long the procedure is anticipated to take, what the perceived pain of that procedure may be, and recovery if we're going to want them on a CRI postoperatively. So those are all the things that come into play of how we pick the order, and also the team, because we all need to stay fresh and on top of it throughout the day as well. So we don't want to potentially do the more physically challenging cases at the end of a 6-hour surgery shift. So we'll figure those plans out as well. Or if a team member may not be comfortable with a certain procedure, either prepping for it or assisting in it, we'll make sure that somebody who will be available during the anticipated time for that procedure to take place, so everyone can perform their best.
I think that's really smart. I can relate from the standpoint of being the one doing the extractions and really getting into some of those bigger, meatier extractions. Maybe there's a lot of teeth, or maybe it's just really big teeth and it takes a lot. In my own experience, what happens to me when those do get pushed more towards the end of the surgery morning, that's when I break teeth. And that's when I say bad words.
You get impatient, you're fatigued, your staff is tired and fatigued.
I'm not methodical anymore.
Right.
Yeah, and that goes with anesthesia as well. We've been staring at these same colors and waveforms for hours, and they all just kind of start to blur together sometimes.
Yep, people have to make sure that they are fed and watered and all of the things to be comfortable for longer procedures for sure.
Absolutely. So I think that's great to review everything ahead of time and make sure everyone is on the same page before we're really even reaching for drugs and things like that to start these procedures. I may have missed it when we were talking earlier about kind of that in the door to induction period. I think you did say pre-medicate them. Do you do that before or after IV catheter, or does it just depend on the patient?
It definitely depends on the patient. So if they had oral pre-meds that the owner gave at home, a lot of times they don't need injectables maybe until closer to their procedure.
Sure.
And then, we might want to get their methadone on board right before induction. If the cat has been really calm and collected and just chilling, we don't need, heavy duty pain meds 5 hours before that cat's going to have the procedure. So we can wait sometimes until they're closer. Now, with that being said, if we have a rambunctious, crazy, 3-year-old Labrador who fractured a tooth who's barking constantly and the pre-meds didn't touch, then, some injectables may be warranted for that case. That is another consideration to take into order of the day. Like, do we have a Belgian Malinois police dog where the handler is actually waiting because they're the only person who can really handle the dog? Like, we're not going to, even though that may be a shorter procedure because it's one extraction and we don't anticipate it to be very painful, but maybe we want to do that one sooner. So the handler is there for the pre-med to get on board. A lot of times they'll carry the dog back, and then we'll carry the dog into the exam room, which is a nice, comfy room for recovery. So they're with them. So it's safer for everybody too.
Yes, I remember. I haven't done one of those cases in quite a while, but absolutely where, you really have to coordinate with the handlers. Those are really rewarding cases.
Yeah, it is. And the handlers are happy, and the way their bond is fun to watch.
It is, especially, these, now I'm getting off topic, but these big, powerful dogs, and they can really just what they do is so amazing. And like you said, the bond with the handler is so incredible because in general, they are not real thrilled to see us at all, but it's that trust they have with the handler, and then that therefore allows us to put that trust in the handler when they're
Mhm.
like, now you can touch him, now you can do this, and like, okay, wait until I hold him like this. It's just incredible.
Yeah,
Like I said, I've got really off topic there, but those are cool cases.
they are.
I understand you have a time in, time out kind of approach
Yes.
to induction and maintenance of anesthesia. Can you tell us more about that?
For sure. I recommend incorporating some type of time in and time out with your anesthetic procedures. Anybody that has a team, that's working with a team, because it really helps everybody on the same page, keeps the flow organized and moving throughout the day. So for a time in, and we actually have a laminated sheet that the person who is holding the pet for the induction, and then the anesthetist assigned to that case, so who will be inducing, and then the doctor who is on that case, the three of us are all together at the time of induction. So we're usually pre-oxygenating at this time. So because the pet is nice and calm, collected. If we had to give something like hydro or methadone on board, that's on board, cooking, so to speak, while we're pre-oxygenating. And then we're reviewing the time in, which is we confirm that we have the appropriate sized ET tubes, the ET tube ties, the appropriate laryngoscope blade, sterile lube for the ET tube. All of this is on a tray. We confirm which drugs that patient received. So they received 100 milligrams of gabapentin at 8 a.m. I just gave this much methadone IV. We're pre-oxygenating. And then we also will review the health status of that pet again. 2 out of 6 heart murmur, thoracic radiographs were normal. Cardiologists didn't make any, unusual requests. This is what we're using for induction. I have some more methadone drawn up. If this is going to be a longer procedure, we'll give some intra-op if we need to. And then we will check the occlusion. So we want to check the occlusion, how the teeth touch before our pet is intubated. Because once they're intubated and that tube is in their mouth, we can't close their mouth to see how their teeth touch. So the person holding will actually pull the lips back with the mouth closed, and we'll take photos from the left, the front, and the right. And the doctor on the case will check the occlusion, because sometimes we still miss it with the pet awake. We don't notice something until they're under anesthesia. But then we have those photos to refer to if the doctor sees something like attrition on the oral exam, like, can we check that one more time? And we can look back at the photo and be like, oh yeah, that incisor was touching that canine tooth a little bit. So we'll take those photos, we confirm all of that. And then the doctor usually steps away, and the 2 technicians involved in the induction will continue through the procedure. The timeout is when we are done with the procedure, and that is to confirm everything has been completed. So this may be with 3 people, so the dental technician, the doctor, and the anesthetist, or the anesthetist with one of the other people, depending upon who's moving on to another case. But we'll confirm that all of the procedures that were planned for that pet were done, meaning, okay, we were going to extract all 4 canine teeth. We're confirming all 4 canine teeth were extracted. We have all those post-op radiographs. We'll confirm if the owner wanted the nails trimmed. We'll confirm if they wanted growth removal done. So we double check everything, triple check everything. We'll make sure that we have our post-op photographs, which are super important.
Yes.
Pictures worth 1,000 words for these pet parents, especially when we're dealing with farther back in the mouth. And then we also confirm that the pharynx was unpacked, which if the pharynx is going to be packed off for a dental procedure, this is vital, because it is dangerous if it's accidentally left in there.
Yeah.
So we automatically pack the pharynx. It's part of our procedure, but we have this 3-step check. So whoever is finishing on that case in the mouth will say, I unpack the pharynx, and we visualize that everything is clean. There's no chunks of calculus sitting on the ET tube or anything. And then the anesthetist will go through the timeout and repeat, did you unpack the pharynx? And then we'll double check. Even if we just did it, we look again. So it is a 3-step process, and everybody's on board with it. It doesn't matter if I just said it. It doesn't matter if you just asked it. We look and we check again.
Yeah.
I think that's super important. And then we'll also confirm, like I expressed the bladder, because we don't want them, being uncomfortable post-operatively, that they may have to go potty, or if they do go, then they're sitting in a mess and they're uncomfortable, and then we clean them. So we'll try to express their bladder waking up. We'll confirm, do you want them on IV fluids afterwards? What rate, how long? And then if they need to be on heat afterwards as well, depending upon how cold they potentially got during their procedure.
I think that sounds amazing. That sounds like such a good just checklist to go through, because even if you do it probably even worse if you do it all the time, because it's so easy to go, oh yeah, we do this all the time, I've got all my stuff, until you don't. And bad things can really happen. It's talking about long procedures, and anesthesia in general, we have to take it seriously. We're fortunate that it's gotten so much better over the years, so much safer. We have a lot of options in that regard, but it is still taking a risk to some degree. And so I love that focus on, we're not chit-chatting about what we did this weekend and having side conversations because, we're so used to this and we do this all the time. We're focused on our patient and we're making sure we're not going to miss any of those check boxes.
Exactly. That's a good point to make. During an induction, and then at that time that pet is waking up, we're focused on that pet. It doesn't matter if we were just talking about our weekend. Once it's time to start that aspect of it, all of that side conversation stops. We can talk about it later. And we're focused on that pet and that pet's safety.
It's time in.
Exactly.
We're focused.
Exactly.
Yeah, I love that. That's such a good idea to have that really regimented protocol. Now, thinking about anesthetic maintenance, you mentioned, if this is a long procedure, I have more methadone drawn up, because dental procedures can be up and down in terms of analgesia because there's intermittent stimulation. So, of course, having our good opioids to make sure we have good pain control and multimodal analgesics. Of course, we have to talk about dental blocks.
Of course we do.
Yes, let's talk about dental blocks.
Dental blocks. If you're not doing them, do them. There's CE that can be obtained for them. Super, super important. If the soft tissue is getting cut into, if bone is being removed, if a tooth is being sectioned, nerve blocks should be on board. The drugs are not super expensive, with the exception of a couple. A lot of them are already in the clinic. We already have syringes, we already have needles. So it's not something that's usually super expensive to start. It is a skill that technicians can be trained to do in most states. Some doctors prefer that they do them themselves, which is totally their prerogative, and that's fine as well. And getting nerve blocks on board before the painful stimulus starts will help decrease that yo-yo anesthesia. So when that painful stimulus starts, the pet's heart rate increases, the respiratory rate increases, and they're waking up, and then the gas goes up, and then they start getting too deep because they're breathing too much gas, and their blood pressure tanks, and then we turn them down, and it's this yo-yo. So we really want to avoid that. With multimodal analgesia that includes nerve blocks, those nerve blocks can prevent that from happening. We can keep that gas at a lower percentage so those pets aren't going through that up and down, and neither are we, and it saves time. So it takes a few minutes to get nerve blocks on board. So it's not adding a lot of time to a procedure either,
right?
But we're saving that time from now waiting for that pet who's waking up to get to a proper plane again. Now they're too deep, and now we have to have all hands on deck to get this pet more stable. So it prevents all of that. So as soon as we know something painful is going to be happening, I recommend to get those nerve blocks on board, because depending upon what you're using, it can take 5 to 15 minutes for those to start working. So if we know we're doing them, get it on board. It's going to change the game.
It really does, and it's so satisfying when you're extracting and just that steady ECG, that steady capnograph, and you're like, I did it. It worked.
Yes, and you know they're working because we're not getting a response.
And I had an anesthesiologist explain local anesthesia to me in a way that really hit home. And she said, of course we have our opioids and things like that, but using those locals, those are the only drugs that will actually stop the pain. We can give our opioids, yes. They won't care about the pain as much, they won't feel it as much, but it's still there, versus we're blocking those, fast sodium channels. I'm reaching way back now.
Yeah, right.
We're actually stopping the pain with those drugs.
Right, it's not even getting there.
Right. Yes, I love dental blocks. They can be, those brachycephalic sometimes,
Yeah, they can be, they're not without risk.
Sure.
It doesn't mean we need to be scared of them. We just
Right.
need to be educated on them and make the best decision for that particular pet. Like if you have a brachycephalic breed whose anatomy just doesn't seem right or normal or safe to do, then don't do it. We can get other drugs on board to help keep this pet comfortable. It's great if we can, but we also, if it's something that's not going to be in the best interest for that particular patient for an anatomy reason, we can try something else.
And I feel like in certain teeth, you have to be, I think, a little bit choosy, but doing even like infiltrative, even if we can't maybe get like an infraorbital or something like that, but, even if we can just kind of go locally and give ourselves a little bit of a cushion there,
Right,
I've found can be effective sometimes.
Like if their eyeball is right next to their infraorbital canal, and it's like, what's the risk reward?
Right.
And yes, we can try something else. I've also recently, actually, one of the lectures I went to this week, a veterinary dentist, she said that she does nerve blocks, and then after the extraction, just do like a splash before closing, and finds that helped a little bit too.
That's a good idea.
I've not heard of that. I can't say I've known any research on it, but
it's worth a try.
Yeah.
I mean, we're not going to hurt anything with it. I don't think so.
Right, as long as the dose is under the dose for that pet.
Absolutely. I'm going to try that. So, we're kind of in this, we're into anesthesia. We're in anesthesia maintenance. And we've talked a little bit about the anesthesia itself, but there's a lot of other kind of things to keep in mind aside from actually, watching our monitors, administering our drugs. What I'm thinking of right now is changing position and making sure that we're doing that safely, because rarely can we do everything we need to do and keep the patient in sternal or in dorsal or whatever we need to do. So what recommendations do you have for keeping patients safe when we're changing positions?
That is a great point, because we do move our patients a lot in dentistry. Most people do their dentistry in lateral. I personally do all of my procedures in dorsal. I love it. Never have to move them, really.
I have heard that, some veterinarians, veterinary professionals, dentists will do entire procedures in dorsal and really like it that way. And you don't worry about water, because that's always my concern when I have them just in dorsal and I have water. I always feel like it tends to pool in the back of the throat.
Yeah, it does. So packing off the pharynx helps with that, and suction.
Okay.
Suction is fabulous. If you have it, if you do your procedures in dorsal, use it. You can get the suction tips that are like bendy.
Yeah.
Exactly what we use.
Sure.
Or when we go to the dentist and stick it in the corner of our mouth, you can do the same thing.
Okay.
And then, move it to a certain area, but it really helps decrease it. So yeah, if you're definitely doing them in dorsal, I'd pack off the pharynx, which is why the timeout is so important.
Right.
But we also will then keep towels underneath their head, so it's not like they're in an abnormal neck position. So we still keep their spine and neck all flat.
Okay.
We just don't have to turn them as much. When they do need to be turned, have somebody help you. So if you have an anesthetist and a dental technician on a case together, they should be moving, even if it's a dachshund, right? Because dachshunds are prone to have back issues.
Right.
So you don't want to flip the little weenie, just flip the legs over and move the head. So we always have somebody holding the head, disconnecting the ET tube, somebody else rotating the body. So it's keeping the pet completely flat, their spine in line while they're being moved. Because we don't want to have that ET tube kink. So someone is in charge of the head and the ET tube by itself. And then reconnecting it, make sure the oxygen and the gas is on what it was at, and to continue with the procedure. And because a lot of our dental patients are geriatric, so they might, have some arthritis. So we want to make sure that they're comfortable. So keep little towels or cushions underneath their hips and shoulders, because we don't want them to go home more, uncomfortable. One thing to think about when they're in dorsal recumbency is that, their hips do splay out. So if you keep some cushion between the table and their hips, then it prevents that, because we don't want their little hips hurting when they go home.
No. Yeah, I can imagine that would make them pretty sore. You mentioned the tube kinking. What about tracheal tears when we're moving these guys? Have you seen that as a major issue, or is this, kind of along the same lines of like, if we're practicing tube safety and we're disconnecting and being careful about it, then we'll be okay?
Yes, in my experience, I have not seen that ever. Maybe I did, like talking like a couple decades ago, maybe. but I wouldn't remember the case. I just remember seeing subacute emphysema when I was like a baby technician.
Sure.
And I think that's what it was from, a tracheal tear, but I don't recall what the procedure was. I have not seen it since being a dental specialist and doing dentistry cases. And perhaps it is because we are so careful with moving our patients and everyone's just aware of it. Patient safety comes first.
Yeah. Well, I think that's really a kind of a powerful message right there to say you haven't seen it being a dental specialist when, even though they're mostly in dorsal recumbency, I'm sure they're still moving to a degree. But I think that does go to the fact that, if we're conscientious and we're paying attention and we're careful, it's not something that like do the best you can. It's bound to happen at some point because it just happens. It's one of those that really can be avoided if we're using good techniques.
Definitely.
Awesome. Well, we've kind of, hopefully we've made it through our procedure here and, teeth are extracted if they need to be and our patient's comfortable. Let's talk about recovery for a minute. What information do you feel like is really important to keep in mind at recovery?
So for recovery, we want to confirm what the temperature is of a patient because with dentistry, they get wet.
Yeah.
So they're going to get colder than perhaps they would for a TPLO. And so we want to, when they're waking up, so before they're extubated even, we'll make sure that they're dry as possible. So sometimes we have a little quiet blow dryer. Sometimes we'll blow dry them a little bit because we just don't want them sitting in cold, wet fur, wet towels. So we'll make sure that they're dry as best as possible. We'll check their temperatures about every half hour until they're normal. And then we'll check it if they're little tiny skinny guys to make sure that they're not getting cold again. We'll confirm if they need to be on IV fluids, for how long, what rate, and someone stays with them until they're extubated. So we don't put them in a kennel and walk away before then and just like kind of glance at them. So someone will stay with them. We'll keep a pulse ox on them to make sure that they're oxygenating properly. And, if it's a higher risk patient, like a brachycephalic breed, someone is going to have to sit with that pet longer. So that's something that we also discuss in rounds, brachycephalic breeds. Okay, so someone's going to be with that pet for probably an hour afterwards. So, that will be part of that person's not going to start the next procedure. So all of that, goes into that rounds again. But we'll make sure that if they need pain medication, we confirm, okay, we're going to be giving this cat buprenorphine when it wakes up. But say the cat was really sedate waking up and we don't want to give it yet, we're going to wait for them to be sternal, maybe moving around their kennel a little bit before we give it. So it's really tailored per patient on what their needs are.
I love that, just that really individual focus on the patient. And I love that you brought up brachycephalic breeds because, you might be there for an hour, one, to keep them stable, but they may just not give you that tube back.
Right.
They're going to keep it.
They'll be like, thanks.
Yes. Yeah.
I live with this now.
Oh, oxygen in my brain. This is so wonderful. One thing I know that people worry about at recovery, people, me included, is sometimes with the mandibular blocks and chewing on the tongue. What would you tell people to watch for? And, are we worrying for no reason with those blocks? Like what tends to happen with those?
No, tongue chewing is a potential complication for doing the caudal mandibular or that inferior alveolar block. I have seen it twice in my career. And I would say most dental specialists have probably seen it once or twice. It's not something that happens often or commonly. When I had seen it happen, it was always the two times it was a larger breed dog. So one was a Dalmatian. I think the other one was a Labrador. So larger breed dogs. So with that, we talk about it afterwards, like what potentially could have caused this. Like we're all specialists. We all have done these blocks thousands of times. So it's not that we don't know what we're doing. So what happened in these cases potentially? And one of the thoughts is with these larger weighted dogs is maybe it was a larger volume.
Sure.
Not necessarily too much for that patient, but the thought is if the volume is higher, that there's more drug then to infiltrate to that lingual nerve and not stay closer to that foramen, which is where we want it.
Right.
And so we won't go over like a 0.5 ml for that particular block anymore, which I haven't seen it since then. But again, we did it how many times with a larger volume and didn't see it as well. So it could be that particular patient's anatomy of where that lingual nerve was when the block was done. But you really want to stay up against that mandibular bone. Whether you do the intraoral or the extraoral technique, you want to stay up against the bone because the lingual nerve, it branches off right about that area. So you want to stay as close to the bone as possible and not going towards the tongue. But it is a risk. The other thing I recommend is to recover patients in sternal recumbency, if possible, with their tongue in their mouth instead of them laying on their side with their tongue lolling out the side. Because sometimes their tongue is just completely dry and they can't pull it in their mouth.
Sure.
And they might start chewing on it, not because it's numb, but because it's stuck out of their mouth and they can't get it back in. And you wet it with a little bit of water, they pull it right in. But if you can recover them with the tongue in the mouth instead of between the teeth already, we found that can reduce that risk as well.
That's probably just a smart thing to do in general, whether it's a dental procedure or not.
Right. Yeah. I mean, it doesn't matter what the surgery is. If their tongue is dry, they're going to be like, what the heck's going on?
Yeah. What is happening? What's hanging out of my mouth here? I'm curious. You brought up the intraoral and extraoral technique, and I'm always curious because I think I'm in the minority of how I do these blocks. Do you do intraoral or extraoral?
I prefer intraoral.
Yeah, I am in the minority. I knew it.
It's personal preference, though.
Sure.
They are doing the exact same thing.
Yeah.
They're blocking the exact same area. It's personal preference. I don't feel strongly one way or the other. However, I have colleagues that do feel very strongly one way or the other. To me, I've been trained both ways.
Sure.
I've worked with veterinary dentists who've preferred it different ways. I can do it both ways. I just prefer the intraoral.
Yeah, no, and kind of similar. Like I've also been trained both ways and I can do both ways. I think that there's like something that goes on in my head when I'm angling that needle down through the mouth that just like doesn't click in my brain as well. It just gives me this insecurity.
It's okay.
It's funny though, like how there's like these, I feel like I have a strong extraoral preference, and but I feel like majority of people do intraoral and really like it. So it's so funny. I always like to ask that question.
Yeah, that's a good question. Good icebreaker.
Yes, I know. Now we need people to like comment and be like, do you do intraoral, extraoral blocks?
Yeah, totally.
All right. Well, now we made it through our procedure. They've come in, they've been induced, they've gone through their procedure, they're recovered, their tongue is in their mouth and safely tucked away where they're not chewing it, and kind of continuing through recovery. Of course, we get to that point in the day now. Mom and dad are here to pick up their pet. What do you talk to the owner about at discharge?
Yeah, so I prefer to talk to them before bringing their pet in the room.
Yeah.
Because once I do that, they're not listening to me.
No, they're not.
And even when I go in there without their pet, they're so disappointed because I'm coming in with an iPad and a folder and they're like, oh, where's my dog? And I'm like, just a minute.
Yes.
We have some stuff to go over.
Your dog is definitely the cutest part of this. We agree.
Yes.
But that's why we're talking about this now.
And then I'll show them the little headshot. So before they were induced, we'll take a little headshot along with their occlusion photos. So we'll go over their pre-photos, their radiographs. Very rarely are they completely normal, but sometimes they are, and we go through them pretty quickly. Otherwise, I point out what the tooth resorption is, what that tooth root abscess looked like. We'll go over the post-op radiographs to confirm that the roots were gone or extracted appropriately. We tell them that there's sutures in the mouth. They'll be there for 2 to 4 weeks, depending upon the suture that was used. And review the medication. So if they're going home on an anti-inflammatory, but we gave an injectable today, they can start that tomorrow. Give it with food or with not food, whatever the recommendations are. I make sure to review that with them. When to feed, how much to feed. Usually they need to be on a soft diet for a couple weeks if they had extractions or major oral surgery. So make sure we review that with them, as well as even something as simple as they had an IV catheter in. And so they either have a little Band-Aid on their leg or we took that Band-Aid off and it's a little shaved spot. I find the more that we can tell them, the less shocked they are or upset when something does happen. So being in specialty practice, I've seen obviously major oral surgery and bad dental disease where they've had oral nasal fistulas. When there's oral nasal fistulas, there is going to be blood coming from the nose post-operatively for up to 48 hours potentially. So I will tell them that we can't suture the inside of the nose, that has to heal on its own, but you might notice some blood-tinged nasal discharge. They might sneeze some blood out. And it's great if they don't, but if we don't tell them that and they do sneeze out a clot, it's horrifying for a pet parent, which I get. It's scary. I tell them probably more stuff than they need to know. And then home care, we talk about when they come back for a follow-up.
Okay.
But home care is basically them protecting their investment, right? Because dental disease is going to progress. It's not going to go away if we do nothing. So we'll talk about and actually demonstrate teeth brushing when they come back in a couple of weeks after they've been healed, because they can't brush the teeth for a few weeks
Sure.
at that point anyway. So we tell them we're going to talk about it when they come back, and usually they're happy with that because they don't want any more information right now.
Right. But that's a good place to get to, of like, okay, all right, I got it. Like, don't no more information, rather than, like you said, if we're not giving them as much information and then they do end up with questions, or like, nobody explained anything to me. If they're like, I feel like if they're at that point where like, okay, no more, like I can't absorb anymore. If they do have questions or concerns and you get that phone call afterwards, it's much more likely to say, you probably explained this to me and I forgot. Can we go over this again? And you're not dealing with an upset owner at that point.
Exactly. Yes. The more you tell them, the better. Sometimes, they might cough for a few days. Long time ago in my career, a cat owner, when I brought their cat out, they're like, oh my gosh, she's crying. And I'm like, no, she's not crying. It was the eye lube, that was like around her fur.
It does kind of look like that.
I know. And I didn't ever see that.
Right.
So now I will tell people, like, we have to use eye lube, and this is why. So they're going to be a little greasy for a couple days.
Yeah.
So I tell them as much as I possibly can, so they're not shocked by anything.
And too, you mentioned cats, which cats can look a little dramatic after a dental procedure.
Oh, yes.
But so many of our patients are like these light-colored, fluffy dogs with so much fur around their faces. And they just, no matter, even with our best efforts, and, we dry them and we brush them and we clean any blood away and do all that, they just don't look the same as when the owner dropped them off.
No.
So I think having owners prepared is really important.
No, a little side tip from that. So if one of the things that I recommend is if there's lots of oral surgery going on and it's long fur around the mouth or curly fur, like a Bichon or a little poodle or something, where like the curls curl into the mouth. And if we're doing lots of extractions, so think of a person who has dentures and they take their dentures out, the lips roll in. So if we have a dog that doesn't have teeth, their lips roll in too.
Okay.
So now they have fur on their lips that are rolling in, and they have a mouthful of sutures and a bunch of extractions, and they'll constantly be licking, trying to get that fur out of their mouth. That I even like just shaving just a few millimeters of that fur just around their lip margin. And I tell the owner that we did that as well to help keep it clean. It's going to help them be more comfortable post-op. And some owners continue doing that. If they have a dog that no longer has teeth and they have a little Bichon, they have the groomer just shave up around the mouth so it's not always in the mouth.
That's such a good tip. I have not thought about doing that yet. I have had owners comment on that when they say, I just feel like they're licking because of the fur and everything like that. That's such a good idea to think of preemptively with those patients. I'm curious your take on, you mentioned a soft diet, which, of course, we're talking major oral surgery where they've had a lot of work done. I have been known to talk to owners about food after the fact if it's, just a few sutures or something like that. And they say, well, I'm assuming they have to be on a soft diet. And I will tell them, yes, go ahead and put them on a soft diet. But sometimes that soft food will get stuck in the sutures and annoy your dog. And, especially if it was a really diseased tooth, I'm going, they weren't chewing with that tooth to begin with. So I will give owners permission. I'll say, let them tell you if they really don't want that soft diet because the canned food's getting stuck in their sutures, go ahead and give them hard food. Don't feel like you can't do that. So I'm curious to know your take on that.
Yeah, that's a good point. So yes, we tell them you have to feed soft food, nothing hard in the mouth. No bones, no chew toys.
Right.
Even dogs that are like OCD about their fuzzy stuffed animals. We saw a dog once that had chewed on his little soft stuffed animal so much that it acted like sandpaper and open up his sutures. I've only seen that once, so it's not common. My own personal cat is a dry food cat only. The cat will not eat anything else.
Right.
So my other cat that's chunky eats everything. This guy's skinny. All he wants is dry food. He doesn't eat treats. No canned food. So he has tooth resorption, so he needs a few extractions every year or so. It's just part of our life. And with him, I will try feeding canned food the night of the procedure the next day. But you know what? It's better he eats. He needs nutrition to heal. So he eats a small dry kibble and he just swallows it anyway. So
Sure.
There is a time and a place where we need them to eat because they need nutrition. So if they're not going to eat the canned food, then if they have to eat the dry food, or I'll even recommend like maybe softening the dry food a little bit, just
Right.
adding some water to it, let it sit for 10 or 15 minutes. It doesn't have to be soup, but it's just as long as maybe they're not crunching on that surgery site.
I 100% agree with that. I'll talk to owners about that. Absolutely. Where, I say if they're really being bothered by the wet food, feed them the dry food. If they'll let you, try to just soften it up a little bit. And exactly like you said, if we don't soften it, make it soup, or we don't soften it too much, it doesn't tend to get stuck in the sutures in that same way. All these little tips and tricks. I love it. This is really helpful to like you do all dentistry all the time. And so I'm like, okay, this is what I do. Is that good? How can I do it better? This is perfect. Well, Denise, this has been such a great conversation. I know I've learned a lot from talking to you here, and I think you have so much good advice, really practical for keeping our patients safe and getting the most out of this procedure. I'm curious to know if there's a take-home message that you're hoping that everyone listening to this really remembers when it comes to dentistry.
Yes, I actually have a couple. One is we really want dentistry to be preventive. And I think in the past, dentistry has been treating really bad disease. And our goal should be, let's prevent this mouth from getting bad. So if we can recommend dental procedures as a more regular every year, every 2 years, because that oral exam and imaging is what's super important. We want to find pathology before that dog needs full mouth extractions. Maybe we only need to extract one tooth. We can talk about home care. So if we can do more preventative treatments instead of one procedure on this pet forever. And the other is that we've all heard it, age is not a disease. It certainly can predispose our patients to have coexisting disease, but it itself isn't a reason not to do a dental procedure. And these older patients that have really bad dental disease, they do deserve a quality of life and comfort. And a painful mouth is something that we can treat in a day. And they can heal from that and be comfortable potentially for years afterwards. The number one thing we hear at a follow-up is that they're acting like a puppy or a kitten again.
Yes.
Because dental is a slow progression, like periodontal disease didn't happen on an emergency basis. It's a slow progression where the body is under chronic inflammation and infection, and it affects so much of the body. And then once that oral disease is treated, that pet is usually happier and healthier, eating better, playing, more social, and the owners are happier, and that makes us happier.
Absolutely. I couldn't agree more. That is just, it makes my whole day when I do those dental rechecks and the owners come in saying, I had no idea, that what was going on here. And now that we've fixed everything, the quality of life is just so much better. I guess, on the flip side of that, like to your point with prevention being so much more important, it would be so nice if we never got to that point where, they were having these symptoms, but man, when they are, we can really do so much to improve their quality of life. And I don't know about you, but I've seen it pay off on blood work more than once.
Oh, absolutely. For sure.
So we can really help these patients. And Denise, I want to thank you so much for joining me. This has been such a great talk. I hope we can do it again sometime because I'm just really enjoying being able to pick your brain and say, but what about this? And how have you seen this play out? So thank you again for taking the time to talk to me about all of this.
Thank you for having me. I can talk dentistry constantly, so anytime.
We're going to get ourselves in trouble if we get into too many of these conversations because we're the same way.
A huge thank you to Denise for sharing her expertise and reminding us why dentistry is such an essential part of what we do. And thank you to everyone for joining us. I hope you took away some helpful tips and tricks for making dental procedures flow smoothly through your hospital. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcast. It'll help other veterinary professionals like you find this and other great content we try to put out there. For more episodes, click on the education tab on the VetFolio website or find us wherever you get your podcasts. We're always eager to hear your thoughts and ideas for future episodes. Please feel free to reach out to me at dvm@vetfolio.com. You can connect with me on Facebook at Dr. Cassie DVM or follow me on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.